Thank you, Mr. Chairman, and thank you, Secretary Collins, for being here. First, I want to thank you for your visit to Arizona and Tucson just a few weeks ago. I think we had a great time there. You got to see what the VA is all about there and their needs and the things that we can work together on. Thank you for spending the time to visit our districts. I know mine is not the first one that you've done that with. I think you have a very hard job ahead of you with a lot of cleanup to do, plethora of issues that I think we've heard about from both sides here. You're getting to them as fast as you can. At the same time, dismantling a lot of the misinformation and lies that are coming out regarding the VA and what your efforts are, and the president's as well. So thank you for all that you do there. Now, I want to focus on the issue of veteran suicide, and you and I have talked about this. I know that's a passion of yours. During our meeting in March, and then again, your visit last in April, we discussed the Arizona Be Connected program that I mentioned, which serves my veterans with their mental health needs and works diligently to forward the goals of the VA suicide prevention strategy, and that was cut under the previous administration. I was and still am looking forward to working with you to find a solution to ensure our veterans, and particularly the ones in Arizona who benefit from this program, who have told me they personally rely on it for their mental health needs, continue to receive the assistance. Now, unfortunately, we don't have full clarity on the status and the future of the program. Now, I know that this is an important issue to you. It's your passion as well. And we did receive some information last night from the department in terms of some of our questions and the answers that you provided there, but still no real clarity there. So I want to talk a little bit on that. And just before I give it back to you so you can talk about that, I want to make sure that we all understand, and especially the department, you and your team, that we're not talking about frivolous partnerships here. This is a program that specifically serves veterans and their families, that specializes in mental health and in suicide prevention for the veterans. Because of the VA scandals a decade ago that resulted in the creation of this program, veteran suicide rates in Arizona were 3 to 4 times the national average, with 260 deaths estimated in 2024 alone. So this is a huge issue for Arizona, even more than in other states. So when I was told that the previous administration was canceling funding for suicide prevention services without communication or justification, what I hear is that I potentially have thousands of constituents in the highest caliber and need being left without care and without the support that we were promised. So I know you agree that veteran suicide is absolutely the last issue that should experience delays in communication and care. So can we commit together to work on this and maybe getting more clarity on the specific future of the program?
Yes, and I think that is in the Be Connected program, and it's what we're wanting to do, and I think we've talked about this before, is making sure the programs that we're going through have key deliverables, things that actually can be measured so that we can get this done. And I'm committed to working with you, and I know we sent the response back to you. We're going to continue to work to make these programs, such as Be Connected, have the measurables that we can make sure that we're getting the results that you've expressed how those are working, and I appreciate that. We also have to look at it as an overview program, how we're reaching out. And it may be something, as we put more emphasis on and more accountability on, that we can expand as we go forward. Yeah,
I remember you mentioning how much money was being spent on suicide prevention, and the results overall of that investment weren't yielding the results that they should, based on the amount that is being there. This one is a public-private partnership. It is yielding results. We'd love to provide, again, the information on this, because it's something that I think can serve as an example, not only to keep promoting it in Arizona, because our veterans are calling for it, because it has worked, but maybe even the model for other states as well. So I would, that is really my top priority in terms of comments this morning. I mean, what are we, afternoon, evening? What time is it?
I'm not sure.
Yeah, evening almost already. Thank you for being here that long. But I'm really passionate about that. It's because, again, Arizona is getting hit at a higher rate with this, and I know this is your passion as well. So I hope we can get even more clarity on answers than even the letter we got last night. Let me just move on to a quick one as well. I was proud to see some of the recent changes that were made on the Officers of Survivors Assistance that I've been advocating for since last Congress, such as moving OSA within the Office of the Secretary to be direct advising body. Can you speak to the impacts your reforms for survivors will have?
Yes, I think that is, and I appreciate your HR 1228 on the prioritizing. We just went ahead and basically moved it. Look forward to you moving the legislation through. We went ahead and moved that back to the Secretary's office. These are ways that we can make these things go quicker, they can be more compassionately handled in others. I make the statement as someone who's been a pastor and also been a chaplain now for many years in the military. One of the biggest things is how we handle these issues of death and end of life and how we go from there. I've sort of described it this way: as you have a medical examiner's perspective and you have a funeral home director's perspective. And I don't mean I'm not making light of this, but it's really true. You have the more clinical aspect of a medical examiner says, you know, your loved one is deceased, they're no longer here. And they just sort of leave it at that. A funeral home director takes that same situation and says, how can I help you and how can I get you through this time, which is so difficult for you and your family. What my goal here is bringing this in as sort of the white glove survivor outreach item, is to make sure that we're giving them the due concern that they have in a time of trouble, in a time of need, but also doing it in a way that conforms to the law and conforms to the benefits that they've earned. So bringing it back into the office, setting this structure up, actually gives them the ability to feel needed, feel wanted, and feel heard, even if the answers that they may get are not what they expected. So, but we're making it here where it's less, what I think is less clinical and more compassionate.
Excellent. Love to hear that. Again, thank you for all that you're doing for our veterans. It's been a little over 100 days, and I think that we're seeing this move in a very sharp, great direction. Keep up the good work, and again, I look forward to working with you specifically on the suicide prevention side on the Be Connected program in Arizona. We'll talk more about that. So thank you so much, Mr. Chairman.